TEDP Training Part 2. This tutorial will cover selecting the chief complaint for triage and entering the duration and pain score for the selected symptom. When using TRM+, this will be the first screen you see after launching TEDP. The Q&A tab is highlighted in TEDP. This indicates that the next step is to enter the chief complaint. TEDP is all about symptoms such as back pain, chest pain, headache, and sore throat. It's important to ask the caller for all their symptoms at the beginning of the call. You'll want to select the symptom that is the most specific, holds the highest level of urgency, or in some cases, when all symptoms seem equal, you may want to triage the symptom that is bothering the caller the most. You will enter the chief complaint in the Begin Typing to select symptom. In this example, I will use the chief complaint of sore throat. When entering the chief complaint, be specific. The first 8 symptoms will be visible in the menu. So if the patient has sore throat and I enter the letters S-O-R-E, the first 8 symptoms appear in the menu set that have the letters S-O-R-E. By entering a space and a T, you will see that sore throat now appears in the menu set. You'll also notice an icon in certain symptoms in the menu. Hovering over this icon indicates to you virtual care. What exactly does virtual care mean? It means that there is a greater than 50% probability that virtual care provider follow-up would be appropriate. The results screen will indicate to you this with the text term. This will be discussed in the results tutorial. Now let's turn our attention back to selecting the chief complaint. Go ahead and select the chief complaint for triage from the menu set. Before we can proceed forward, you will need to enter the duration of the chief complaint selected. This is the overall length of time that this acute symptom has been occurring. As you can see, the first column is numeric, so I'll go ahead and ask my patient how long this has been going on for, and let's say he indicates to you 3 days. I will select 3, and in the second drop-down menu, the minutes, hours, days, weeks, months, and years will be visible, and go ahead and select 3 days. I then select Next, and the pain score for the symptom I selected will need to be entered. Pain score in TEDP is relevant only to the symptoms selected for triage. It is not their overall pain they experience every day, such as in chronic back pain. In certain cases, a selected symptom is not pain associated. Example of this would be depression or anxiety. In this case, you would select Denies Pain, which represents 0 and will be recorded in the final note. But back to the sore throat pain, I would open up the drop-down menu and ask the caller on a scale of 1 to 10 how they would rate their pain. I'll go ahead and select the pain that the patient indicates to me to be recorded in my final note. It is important to note that both the duration of the complaint and pain score do not drive the triage program. TEDP, when needed, will collect additional duration and pain assessment during the triage process. Training Part 3 will demonstrate the continued triage process after selection of duration and pain score in the triage program.